Hello everyone, my name is Anisa,
Hi, my name is Jacky.
and today we're going to talk about a research project. It's called In an Effort to Reduce Overprescribing Antibiotics in Uncomplicated Outpatient Upper Respiratory Infections, should the focus be on provider training or patient education? This is an evidence-based review. So to start off, in the United States, antibiotics are some of the most prescribed medications for upper respiratory infections in the outpatient setting, despite their ineffectiveness in most etiologies due to their viral nature. Antibiotic resistance is predicted to cause 10 million global deaths annually and cost about $100 trillion globally by 2050, yet their use continues to climb. So the goal of this review is to lower unnecessary antibiotic prescription, focus on provider versus patient education, and discuss ways to implement change within our healthcare system, as well as develop the most cost-effective and pragmatic approach to reducing this global crisis.
So moving on to the methods section, a literature review using articles from PubMed was conducted for the purposes of our review. Randomized control trials, cohort studies, and reviews were all used to stratify the conclusions of our study. And moving on to the results, I wanted to briefly mention a couple of studies that we found important. The first one being called Educational Effectiveness, Target, and Content for Prudent Antibiotic Use by Lee et al. They included clinical education for patients and caregivers, which included seminars, small group education, interactive seminars, mailing campaigns, and then a combination of the above. They found that interventions were effective in reducing antibiotic use in more than 40% compared to the control group who received no training. And then moving down the list there, study by Wei et al., which included doctor, patient, and caregiver education focusing on antibiotic use and misuse. They concluded that antibiotic prescription rates in the intervention and control groups reduced from 84 to 37%. And then we measured at 18 months, the antibiotic prescription rate was 54 and 75% in the intervention and control groups, respectively.
So, the consensus gathered from article analysis helps explain that the most effective interventions focused on both the patient and the provider. Indeed, the studies that were investigated in this review either mentioned a joint effort to educate both the patient and provider about antibiotic employment, or concluded that the multi-pronged approach in addressing prudent antibiotic utilization would need to include both the patient and the provider. So, in conclusion, overprescription of antibiotics by providers for uncomplicated upper respiratory tract infection in outpatient setting is a growing problem despite continued efforts to educate both the providers and patients about the implications of their use. Targeting this growing pandemic requires both focusing on patients and providers. And despite similar conclusions drawn in the current literature, one specific question begs to be answered. Should the emphasis be towards the patient or the provider?
Unfortunately, in regards to cost effectiveness, none of the research studies that were analyzed broke down each intervention's prices individually. However, some did provide pricing based on the facility, as demonstrated in Wade et al. And Butler et al.'s articles. Given the information provided at this time, we cannot recommend focusing on providers more than patient education or vice versa. However, we can suggest that both provider and patient education approaches combined may be the most effective as demonstrated by the Colorado project mentioned above.
So, physician assistants or PAs are healthcare providers in the US that diagnose, treat, and manage patients with upper respiratory tract infections in outpatient settings, just like physicians and nurse practitioners. Therefore, PAs need to understand the resources available to them and the approaches they can pursue to limit the growing antibiotic overuse pandemic.
So lastly, we included some references there. If you have any questions, please reach out to us directly.
Yep. Thank you, everyone.